Hello, this is Dr. Scott Kilberg, the Video Foot Doc, here with another video on all things foot and ankle. Today I'm going to talk about ingrown toenails. Far too many people in this country suffer needlessly from ingrown toenails and allow this condition to continue time and time again. Ingrown toenails are very common. You're either born with it or you simply develop ingrowth of the nail because of pressure from tight shoes over a long period of time, having dropped something on your toe or stubbing your toe. Any number of things can contribute to the fact that the nail, instead of growing straight out, will begin to curve inward towards the skin a little bit. Now fortunately, the fact that the nail curves in towards the skin doesn't seem to cause much problem. The skin is more than comfortable with dealing with the nail being close and sort of pinching into it. However, when the skin alongside the nail becomes inflamed or irritated, such as what happens when somebody has an ingrown toenail and kicks that side, or when one tries to cut the ingrown toenail back too close and ends up injuring the skin a little bit, then inflammation will start in the skin, and as the skin begins to swell up and pushes against the nail next to it, it will begin to hurt. And this inflammation can also trap bacteria, and that's often why many ingrown toenails become infected. The problem is that it doesn't matter how you cut it from the end of the toe or the end of the toenail. The toenail itself grows strictly from back where it begins underneath the skin, and where you cut it at the tip of it just doesn't do anything. It's not going to affect the actual growth pattern of the nail itself. And so what will happen with ingrown toenails is many people will simply cut them back, deal with the infection by either taking an antibiotic per prescription from a general practitioner or just simply using antibiotic ointment and some soaking. And the infection and inflammation eventually resolves, but then the process starts all over again as soon as the nail grows out a little bit further, or as soon as they stub their toe again and cut the nail back and cause the problem to start all over again. Treatment is so very easy and so very simple, and it only takes about 10 minutes worth of a procedure inside of a podiatrist's office. What happens during the treatment is the toe is numbed up and the side of the toenail that's ingrown is simply cut and removed. It doesn't involve any incision in the skin, no skin is cut in the process. You're just simply trimming the nail down the side of it, much like you would trim the nail across the top. The toe must be numbed up in order for one to do that, because it potentially could hurt if the toe wasn't numb. But it's a very simple procedure, and after the nail is removed, you actually do have to address the nail root that grows the nail in that area, because if you let the toenail grow back in that area, the same problem will happen. So what one will do is a surgeon will take a chemical, usually something called phenol, which is a strong acid, and that is used on the nail root and only on the nail root at that particular area to destroy the root cells that are growing the nail out. And with a little bit of recovery, which includes daily soaking in warm soapy water and covering the toe with a Band-Aid and some antibiotic ointment, the toe will heal generally within about 2, maybe 3 weeks. There's no restrictions generally. You can go about your activity and do whatever you want, and then once the toe fully heals, you will have no further ingrowth of the toenail and be completely cured of this condition. So you can see there's no reason to needlessly suffer from ingrown toenails chronically time and time again. This can be a very simple thing to fix. It takes 10 minutes in a podiatrist's office, and essentially the only discomfort one has from this procedure for the most part is just simply getting numbed up. It's not really that sore afterwards, maybe a little bit of discomfort for a day or two, nothing that a little Motrin or Advil can't take care of, and you have a lifetime cure. So if you do encounter this problem and are chronically suffering from this condition, go talk to your local podiatrist and they'll be able to take care of this for you permanently. Well, I hope you enjoyed this video. Look for more videos on all things foot and ankle on this site as well as others, or you may look at my website at www.inpodiatrygroup.com. Thank you.